If I can add to your comments, my understanding, when you apply to be eligible for Medi-Cal, you go to the county, you fill out the application, the county then sends it to the state for the eligibility part. And then when they're eligible, it could be 10 days, it could be 2-3 weeks. Back then it was like 4 to 6 weeks when it first started. I don't know what it is today. And then it goes back to the county if there's problems. If not, then it goes to CalOptima in Orange County, the managed care system. I mean, for me, it's like, I don't know why we have to have so many hands in the same pot. If you just leave it either to the state, you deal with it, you do the application, everybody submits it to you directly, or let the county do it, or let the managed care system do it. You have 3 hands, and you know what happened at the County of Orange is when someone who applies, who lives in my district, calls me up and go, well, I've applied 3 weeks ago. I call the county staff, they're like, oh, we don't know, it's the state. Then they go, oh, well, no, we don't know, it's CalOptima. Oh, well, everybody's doing this. And so, you know, even with the funding that you have, you could eliminate it, whether it's from the county side, the managed care system side. It's just too many hands in the same pot. And then your next, that's a comment, not a question. Your next comment on the provider rates. You know, managed care system is really the middleman. The state provides the increase, but when it comes down to managed care system, like in Orange County, CalOptima, or in LA County, LA Care, they're still all, middleman always takes a cut. So the increase doesn't get really down to where it needs to be, direct services for these providers. I mean, you know, sometimes I see a lot of our problems in terms of healthcare is there's just too many people. I mean, the state is really the middleman between us, the local, and the federal, and then we hire another middleman, and that middleman becomes, you know, the managed care system and some of the IPAs, independent contractors, and then there's subcontractors to that. So there's so many middlemen. So for every dollar you increase, everybody's taking a cut off. So, you know, something to think about is, you know, can we make it so that it's more efficient and that the money goes to where it has always been intended, is direct services, you know, and so, you know, please look at that, and if there's a way that, you know, we as a legislator can help in terms of efficiency, I think that's, you know, somewhere we should look at, because there really isn't that many managed care system anyways in California left. And the dropout rates for a lot of the managed care system with the Medi-Cal MediConnect has just completely, what an embarrassment. You know, and both of my counties, from LA County and Orange County, has been the worst. Well over 40% dropout rates from Cal MediConnect, which the intention of that program 3 years ago when the legislature implemented it, before I was here, was to save money. Instead, almost 40% or more have dropped out and are now sticking with the fee for services. And that's where the bulk of all of our money is, from these Cal MediConnect individuals. It's the dual eligible. You know, and so I think it's looking at some of our way of doing business, because again, at the end of the day, I really believe that money needs to go direct to the direct services. That's the only way we can get more providers. That's the only way we can get quality services. I have a comment for the disabled community, the development disabled. My concern is, I know that we're looking at tying it after the MCO tax potentially could pass. That's the MCO tax last year, the proposal was a permanent tax. This year is only 3 years. Does that mean the administration is only looking at funding the DDS for 3 years because MCO tax is only for 3 years? Or was there any look into the future of having it permanent? Or are we going to give them 3 years and then we're going to roll back?
I think the 3-year sunset is in recognition of just being realistic about what we can get through the legislature and also with the federal government. But managed care organization financing reform is definitely part of our long-term approach to keeping our precariously balanced budget in balance over the long term, and bringing in those additional federal funds are very helpful to keeping our healthcare system funded. So that continues to be a focus. I think in terms of rate increases and temporary anything, those are very difficult to structure, and I think would be very disruptive to the system. That's why we have been so cautious and targeted about our approaches on rate increases, because to roll those back, certainly that was done with provider rates during the recession, but it is very difficult, and especially in a managed care organization environment, you really can't tease out the increases once they're given. It's very difficult. So I think that in terms of rate increases to the DDS community, we would not want to develop something that would be disruptive going forward and not be helpful to their underlying concerns. So that's something that we will continue to work through the details, but that's why we prefer a more targeted approach to really fix problems that exist out there, as opposed to an across-the-board, which is more like an inflationary adjustment. And I will note that rates have been adjusted in the recent years for the increase in the minimum wage, as well as the implementation of overtime through the labor agency, the Federal Labor Agency's new rules that we are implementing in the IHSS program and in the DDS program.
Thank you. Mr. Taylor, I have a couple questions for you. The budget assumes that we're talking about the higher education side now, that UC will enroll 5,000 more students, undergrads, that are from California, that are residents of California. However, recent reports show that about 1,600 fewer California students are enrolled at UC last fall in 2014. My question to you is, any thoughts on how we as a legislator can be assured that these slots that we're paying for, the 5,000 slots, are funding, these fundings are providing California students more access?
Well, you've sort of moved in the opposite direction of giving the segments less restrictions on what they do with the money that you give them. You don't really set an enrollment target anymore, a per student funding. It's sort of residents, non-residents. So you can put whatever language you'd like in the budget that fulfills the requirements that you'd like, and hope that the governor would leave them in, I guess.
Thank you. I have one more question on the cap and trade for LAO. How much are motorists paying for placing gasoline under the cap?
We did some work on that, and I don't think anyone knows for sure. I think the range was anywhere from 10 to 15 cents a gallon. I think more people maybe are leaning towards the lower end of that spectrum, so it's kind of hard to know of how it. Pardon me? Yeah, I think that was at the lower part, but I think that was where a lot of people have been coming down. That's probably what it added.
Maybe if you can answer this question, if the bulk of the money that are being paid by the motorists to the cap and trade, don't you think we should spend more of that money to maintain and improve our current road system because they're driving on it?
Well, the situation you have with cap and trade is that people are paying this charge to try to sort of internalize the cost of their carbon emissions. So you pay that based on your carbon usage. It's not necessarily then turn around and allocate the monies back towards who paid it. I think what you're limited to now by the courts, we think, there's court cases out there, is that you need to use those for greenhouse gas reductions of some type. Now, that could change if you try to extend the cap and trade program, because now you're under a Proposition 26 rule, which is different from where you were when you passed this with a majority vote. So you've got some legal issues hanging out there, but I'm not sure necessarily that, who pays it necessarily should go back to you. It's really for a very different purpose.
I disagree, but we can always disagree. And then just last one. In your report, on page 15, oh wait, no, I'm sorry. I'm sorry, no, page 11, is the Prop 98 funding to local control funding formula. Is there any way we can get a school district per student list of how much we're paying versus just the overall, the 6% increase per student? So if we can maybe get a list for like school district, I'm very more curious in my district.
Sure, I believe that's available, but let us get back to you on that.
Great, thank you. Thank you, Mr. Chairman.
Thank you, Senator. Colleagues, I just want to remind everyone we have session in 35 minutes. We have 3 more members of the committee who would like to speak, and we did want to afford the public some time to comment. So we're going to have to ask if we can be as circumspect as possible. I hate to cut anybody short, but go right ahead. Senator Hancock, then Senator Pan, and Senator Block.
I will talk very quickly. But we will have time in our budget subcommittee hearings to take a lot of these things piece by piece. And I appreciate the difficult charge that the administration has in balancing the needs and choices that we have to make. So I am interested in some of the macro things that we're looking at right now. And I have to say this hearing has underscored for me how important the MCO tax is going to be if we're concerned about programs for the developmentally disabled and the erosion that's occurred in our health and human services system and how to stabilize that. Because I've been concerned that we talk about an expansion and pretty soon there's going to be a contraction. Well, really, what we have here, I think, is what some economists refer to as an immature recovery, or a recovery that has been slow and incomplete in that many people have been left out of it. We do have the highest poverty rate in the country using the federal recalibrated formulas, and we're told by the institutes at Stanford and Davis, UC Davis, that study poverty, that housing is one of the major reasons. But I didn't see anything in the budget addressing housing. And I just wondered, do either of you, the governor's office or the LAO, do any kind of cost-benefit calculation? Do you have any kind of a formula? I know that there are some human service systems that do that. The Pew Charitable Trust does it for corrections programs, so that at some point an investment is an investment. It will pay for itself because you'll have people earning more money, spending more money, paying more taxes, or not going to prison. We're trying to break the school-to-prison pipeline. That might have implications for preschool and after-school programs. So or is that not in your purview?
Certainly, all of the analyses that are done, especially about investments that do prevent costs, like incarceration, are things that absolutely cover the analysis that we do in our office and are part of our deliberative process. So yes, I mean, we look at that. We don't have specific metrics for our own programs, but it is that body of research are things that we look at when making choices, policy choices. choices. In terms of housing, this is an issue that we had a lot of discussion about. It's an issue on a lot of Californians' minds, especially if you're living in very high-cost areas of the state. And housing really is primarily controlled by local governments, cities and counties, who are responsible for siting the development of new housing and infill housing. I will note that the Cap and Trade program has made significant investments in low-income housing, and with this budget allocation, $1 billion in Cap and Trade monies will be provided to our Sustainable Communities program for strategic investments in housing that follow a transit-oriented development model, really get people out of their cars and into walkable, bikeable, transit-oriented communities. So that's one thing that we're doing related to housing. I also mentioned earlier the CalWorks Rapid Rehousing, which is a program for the lowest income Californians, really a housing insecurity security program for those that are imminently at the threat of being homeless. There's also, through the work with the legislature, some veterans bonds that have been recently repurposed for investment in facilities that support homeless veterans. And then I would also point to a new $25 million item that we have in the budget to help us site facilities for our prison reentry beds and other types of supported housing beds that are just, frankly, very difficult to site in many local jurisdictions. But we do know that there is huge value in supportive housing, especially for our recently incarcerated populations in communities, and that continues to be a priority for the administration. In fact, our corrections budget assumes that we will increase our beds in the community from 220 to 680 beds. And that may not sound like a lot, but getting those cited is a very difficult charge, and something that we need to sit down with the League of Cities and the counties and really work through some of the challenges in getting that kind of supportive housing cited.
Thank you. And I am interested in when we choose to bond and when we put general fund money in, because in the corrections budget, we pose another $250 million in lease revenue bonds for jails.
Oh, general fund.
Right.
General fund.
Fund this time around.
Oh, it's
yeah.
general fund this time. Okay, which is good, because we were discussing the fact that there basically is no revenue to pay for the $500 million that we put in the 2 previous years. But for me, that was attached to, there's the $25 million in general fund that you're giving the community colleges for innovation grants. Has there been any thought of putting some money in CDCR for innovation grants? Because Senator Nielsen alluded to this, I hear it all the time from my colleagues, and we all hear it from our districts. The population's going down, the budget's going up. I know there are many reasons for that. Standardized staffing, which means you have to close a prison or a prison yard in order to get any savings, since personnel is most of the money. And frankly, the cost of a decent rehabilitation system, since we virtually eliminated any education or rehabilitation in our state prisons. But we know that a country like Norway, which does things quite differently, which we had an official Senate trip to this summer to visit their prison, they have a 20% recidivism rate. That's where we get into the cost benefit. We have about a 60% recidivism rate. You could save hundreds of millions of dollars with some light and air in the system here, let alone some of the huge costs we've had from abuses in the prison system and lawsuits, which add to our money. So how would we put things like that on the table so that we can get them to happen? Or perhaps it's just part of, as you keep saying and the governor keeps saying, we have a lot of needs and choices have to be made.
But I do want to highlight one thing that I think you were a big part of putting in motion last year, and this is an effort at the community colleges surrounding inmate education. And I did have the opportunity to recently meet with the leaders at the chancellor's office that are leading that effort. And I definitely think that they are harnessing innovation and will be deploying that innovation to correctional facilities across the state. Their intention is actually to reach every facility. And I think there's a lot of, through the sustained efforts over many years of having those conversations, I think that they're really starting to dig in. So we're really harnessing the innovation of other community colleges to help with our correction system and the educational needs that are there. So we'll continue to look at the initiatives that they're working on, but I think that there's a lot of really good ideas coming forward through discussions with leaders in this field. The other thing that I wanted to talk about, because it's come up a few times, is the growth in the correctional spending. And I think it's really important when you do that sort of analysis to kind of to better understand the trajectory that we were on versus the one that we are on now. And if we had continued to go along without realignment, there would have been approximately $1.3 billion in additional money spent on corrections above what we're currently spending. This is because we would likely have had to purchase additional beds out of state, in-state contract beds, maybe build even more infill housing than we have built. But I think it's important there are natural costs that are increasing. The receiver is certainly a component, as Mr. Taylor mentioned in his response on that question. Also, the general growth in employee costs is certainly there. Corrections is a people business, but we continue to manage the prison population to comply with a 3-judge order, and also despite all of the many changes that we have made. And for those of you, especially Senator Hancock, who's been working on this issue for a long time, our prisons look radically different than they did during the peak of their overcrowding. This is enabling us to move to provide more programming, to provide more opportunities for offenders to get the skills that they need to move out of the criminal justice system and not come back. So that I think that's something that we've been really building for many years, and the numbers don't tell you that. The $1.3 billion, the increased costs they are also in recognition of the hole that we really started in with very little programming and healthcare that was not at the standards required by the receiver.
No, it was a hole, and I appreciate so much the community college program. The governor signed the bill. It's happening, and it's very, very positive. But have you considered repurposing this year's $250 million in jail money to be much more specifically targeted to reentry services and supportive housing, all of those things that are so critical? Well, you can answer. I keep hearing from sheriffs, from all kinds of people now, that they don't have the infrastructure for reentry. And
I think that there's a recognition that supportive housing is definitely a weak link. That's something that more is needed everywhere you go. And right now, there's a lot of offenders, and they're all competing really for those same beds. That's really was part of what underpinned our interest in putting the additional $25 million, because there are some barriers to getting those facilities sited locally, and that $25 million is really in recognition of that. The $250 million is really targeted for jail construction, is targeted to those counties throughout the state that have not received any money through previous grant offerings. Under realignment, some offenders are spending a longer period of time in jail than they did before realignment, and many of the jails and locals were not set up for those kinds of longer-term inmates. And so a lot of these monies that have been put into local jails have really been in modifying the existing space that they have to make it more conducive to those longer-term inmates, and also providing the types of supports and services, or the types of facilities that are needed to support the mentally ill populations that are incarcerated, as well as the staffing that goes along with providing those additional services. So a lot of the money that's been spent to date has been really to remodel and the jail facilities to make them more appropriate for the length of time offenders are staying now.
Yeah, actually, you know, as we know too, jail management is extremely important to this. More than 60% of the people in every county jail are awaiting trial. They have not been convicted of anything. They're too poor to make bail. So maybe we need to tie some bail reform or risk assessments to this, because as you also know, there are a number of counties who've turned the money down because they would like to do more positive things. So we're going to need, I think, to look at all of that, and I do look forward to working with you on this as we move forward.
Thank you, Senator Hancock. I'm glad you were able to address some of the issues in your subcommittee that we hadn't gotten to yet. Our last committee member to comment and ask a question will be Senator Pan, and then we will get to public comment for hopefully 10 minutes before we have to adjourn to get to session. Sorry to be keeping people with a false promise of allowing everyone to speak today, but there, of course, will be time through our months-long subcommittee process. Senator Pan.
Thank you, Senator Leno, for the opportunity, and I want to thank our presenters. I do appreciate the governor's caution in terms of looking at our economy, and also his investment in some of the infrastructure that we have that we need to really maintain. Yeah, and so I know that we'll get into the details as we get into our various subcommittees, but a couple of comments and questions. You know, as we're talking about our infrastructure, and I know, again, the governor's investing in some of our physical infrastructure. You know, we talked about human infrastructure for our social service programs. I'd even say our information infrastructure as well. We haven't talking about many of our IT projects and so forth. And I know Senator Hancock touched on this. When we do an analysis, I mean, you said internally you look at rate of return. I mean, when we say investment, there's a rate of return attached to that, actually. I mean, it's great to use the term investment. There should be a rate of return attached to that. What's the return we expect to get back? Is there a way that, and I understand that, so Azri said that there's internal discussions, but is there a way to have that more explicit so that's available for the legislature and the public? I mean, there are things that we should be doing that when we make an investment that we're spending money, and then we should projected what's the return back on that in terms of whether it's fewer social services used, we're maintenance, lower maintenance costs because we're actually taking care of the physical infrastructure, et cetera. And I don't know, also from the LA perspective, as we go to the public and say, let's put some more money into this, and actually I can think of several examples of healthcare. I won't get into it right now, but we just heard about prisons and education and so forth. And even if it's not even long-term, even just short-term, is there a way to have a more open discussion about that? Because I don't think we talk enough about it. We just talk about how much we spend. We don't talk about what we're going to get back.
Yeah, I mean, I think that as part of our transportation financing proposal, we have attempted to put together a set of performance measures for the investment of those monies so that people can really understand in a tangible way how the monies are going to impact the roads that they drive on every day. So I think there are definitely targeted areas where we have a more formal performance analysis attached to maybe a proposal. I think systematically it would be a very difficult thing to do. But again, absolutely, when the administration is deliberating on proposals to put forward in the budget, we're reviewing literature about return on investments in certain areas and making implicit policy choices based on the underpinning of that research. But to put forward specific performance metrics for every program is a significant undertaking and something that we have been working on a targeted basis to do so. Some of times they're called zero-based budgets, where we really drill down and better understand what is needed to provide the services that government provides. In other areas, it could be a different type of review.
And sorry to interrupt, but I also know we're short on time. I just, but there's also, let's say, also on the other side. So, for example, by paying sometimes below cost for Medi-Cal, and we will get again low Medi-Cal managed care, and people having unmet health needs because they're not able to access care, there's actually a cost to that. Not just to the person who isn't getting the care, there's obviously costs there, but there's also other costs associated. When we have people who are in prison and we have a high recidivism rate, there's a cost to that too. And so sometimes when we subfund things, we're actually generating higher costs. In fact, I would argue, as we talked about some of the cuts that we made back in recession, there were a lot of decisions that were made to do short-term savings, recognize there's a long-term cost. Well, the long-term is now, right? We made those cuts. We're now suffering from, and so how do we unwind some of that? I know the governor unwound a lot of the fiscal stuff in terms of the budgets and the shifting them, and I appreciate what he's done there, but I'm not sure we've untangled some of the other stuff that we've done, and I think we really need to look at that as we're looking at what the appropriate funding is. I'm not going to talk about which ones need to be restored now, but what the appropriate funding levels are. And then I guess the other question is, and this is, since I don't sit on budgets of 3, but the oversight part and in relation to this committee and what the budget subcommittees are going to do. So we talked about managed care in Medi-Cal, but we also know that we see poorer performance and issues in Medi-Cal, and so when you say, well, they're all actuarially sound in negotiations, what exactly does actuarially sound mean? It makes us all feel good. Oh, it's actuarially sound. But I will tell you that I think a lot of health plans, when they negotiate with private employers, I don't think the private employers are looking to spend lots of money on health care and don't care how much it costs. They care too. And yet you're talking about poor population with more needs actually costing less than a highly negotiated rate that a private employer would do with the same health plan. I would think it's kind of remarkable to say that that actually sound rate actually necessarily, so the question is, what is in the actuarial analysis that lets you say that that's actually sound? And in fact, I think there needs to be more oversight. And in fact, that's what I'm curious about in terms of looking at, are we putting the money into the oversight that the agency should be doing over these contracts, whether it's Medi-Cal or a bunch of other ones? We have $3.6 billion in IT contracts, all right? That's not a small amount of money. And we've seen a few IT problems, that certainly in budgets of Breeze, et cetera, where there's been insufficient oversight, where we've basically not invested in the oversight that we need on the state government side to be sure that the job gets done right. And instead, when things blow up, we then pass the costs down to the people who receive those services. And so I'm hoping that as we're looking at it, it's great to say, fine, we got managed care companies, we got these contractors, et cetera, but what is the level of oversight that's happening that the administration is going to invest, pay for to be sure that they're doing their job? Because in the end, it does cost the state and the people more when that happens, when things don't. So, whether it's talking about Medi-Cal or IT or lots of stuff in between. And finally, I guess I also say is that when we look at some of our expenditures, aside from the services, I'd also be interested in looking at some, people often talk about multiplier effects, right? So, and we talked about that actually in the Medi-Cal expansion. I appreciate the governor supporting the Medi-Cal expansion and putting money into that, and I know that's a tremendous, investment by the state, but also looking at not only the people getting healthier, but the fact that we probably created, it was projected we'd create over 100,000 new jobs doing that. And maybe we should follow up and see how many new jobs we created. And the fact is that when we spend money, on doctors, nurses, clerks, other people, other health professionals, et cetera, those people are paying taxes. So there is a return there too. And then as well as the people getting services and how they're better positioned then to pay back. So I'm hoping we can look into some of that. I agree, we probably can't do a return on every program, but we have several large programs that we spend billions and billions of dollars on. It's probably worth looking at, are we spending that, what are we doing, what's the rate of return as we're looking at that. We got our big four, right? We have education, K through 12, higher education, Medi-Cal, health. I mean, we probably should think about looking at that and also educating the public as well about what the kind of decisions we're making and what's driving them. So I've maybe just a brief comment from the LAO as well about, am I asking the impossible or?
You're asking the difficult.
I'm asking, well, I think doing something that's difficult but important is worth doing, but I appreciate
I think you're absolutely right, and this speaks to Senator Hancock's point about sort of evidence-based research of when you're looking at the margin for where you might spend that additional dollar, it's a little bit easier because you can look at a particular program, you can assess it, you can run a pilot on it. And you could sort of, did we get our return that we expected? When you take something as broad as higher ed, well, what are you assessing? That last marginal dollar, those last students that you brought in, that last program that you tacked on, the money that you gave them for the retirement, it becomes just a lot more difficult as to, well, what are you really asking for that return on? So it's very reasonable, your overall approach. I think it's just when you get down to looking at a particular infrastructure project or deferred maintenance, do you really have the data and to both have confidence in what what someone's telling you is going to be the return on that, and how does it compare with the 150 other deferred maintenance projects? It gets kind of difficult.
Well, I'm hoping we can both work together, the legislature and administration, in trying to at least come up with on some of the larger things, an approach to try to do this, because I think it is going to be very helpful and important to the public to know that their tax dollars are being spent wisely, and that we are looking creatively at trying to make the best use, whatever the size of the budget is, of the money that we get.
Thank you, Senator. All important points. How many folks do we have who would like to speak? Public comment today. Step right up. We probably just have 5 minutes or so because we have to get to session, but please come forward. Well, we've got 3 folks. Take a minute each.
We'll be really quick. My name is Jackie Dillard Foss. I'm with the California Supported Living Network, and I want to appreciate everyone's comment around the developmental disability population and the provider community that continues to struggle. I did want to address the investment. The minimum wage and the overtime are mandates and not investments, and recognizing you, Senator Leno, for those staff that have worked for and in this community for a long time, for 13 years, 14 years, and making very minimum wages. So we need to invest. Thank you. I know there's a lot more time to talk, and I feel like I'm having deja vu because it's really fast.
Thank you.
Mr. Chair and members, Rick Rollins here on behalf of ARCA, Association of Regional Center Agencies. We want to thank the administration for putting forward 2 opportunities for us in the DD community to seek the much-needed additional funding to our system, both through the MCO reform package that's coming forward and also in the budget process. We look forward to working with the administration and with you to ensure that the DD community gets their fair share of the MCO allocation that will be coming down, and also working with you through the budget process. Thank you.
Thank you, Mr. Rollins.
Tony Anderson, Executive Director of the ARC California and representing United Cerebral Palsy, but here for the Lanterman Coalition. And I want to thank you, Senator Leno, for your message, everybody's messages about what's happening in this community. You definitely got the message, you know what's happening in our community. But I need to tell you quickly, a couple of new things that have just occurred. We had a provider in Bakersfield who shut down a large service that they were providing in the area for people with very, very serious needs, health needs. And then we recently, a week ago, had a provider in the the San Jose area who stopped providing transportation services. They just couldn't do it anymore. We had the one in the East Bay a month before that. So these things are the real results of these years of not funding to the level that we need. So just another reminder of what's happening. Thank you.
Mr. Anderson.
Good afternoon. My name is Kevin Asney. I'm with the Coalition of California Welfare Rights Organizations. And what was very surprising in the budget this year is that while there's $6.7 billion available to the CalWorks program, the budget only allocates $4.7 billion. $2 billion is used what they call contribution to the general fund. So if you're wondering where did that rainy day money come from, it came from the mouths of poor people who are living at the highest poverty rate in the United States of America. California has the highest poverty rate of children. So we would urge you to look at that $2 billion, and at least 10% of that would pay for the MFG with the maximum grant plan. Thank you.
Thank you, sir. All right. Well, thanks for recognizing our limited time here today for your participation and articulate presentation of the governor's budget. Thank you, Ms. Bosler. And Mr. Taylor, always thank you for your analysis, and we look forward to seeing more of it in the coming weeks as we begin our subcommittee process. And we have a couple of other full budget committee oversight hearings, broader looks at a number of different important issues in the months of February and probably early March before we fully dive into the subcommittee process. So thank you all for being here today. We are adjourned.
See you on the floor.